Good morning. My name is Dr. Grant Olivier, and today I would like to discuss the danger signs in men's health. So, when should you really be worried? So, what are the main danger signs and what could it mean? Let's start from the head and we move down towards the toes. So, when we look at the head, we think about, uh, we want to focus on the brain. So, you could have a stroke. So, if you have a stroke, we use the acronym FAST. This means face, arms, speech, and time. So, what you'll see on your face is you'll have facial drooping, meaning weakness in one side of the face. When we go to the arms, you will have weakness in your arms. You'll also have a slurred speech and time. Time because brain means time, meaning that you need to act fast. So these are the signs that you need to look out to see if you have a stroke. Other things that you can also face is dizziness. This can be vertigo. This can either be from the brain or it can be from a problem with the vestibular system within your ear. Other things that men face also is hair loss. Hair loss can be from stress or it can be an autoimmune disease, meaning your body is actually attacking its own hair follicles, seeing it as foreign, and this thing it can be things like lupus. Also, thyroid problems can also cause you to have hair loss, and also things like ringworm. So these are things you need to look out for. Also, if you have severe memory loss, this can be a sign of Alzheimer's and also brain tumors. Please be aware that it's not always to say that you have Alzheimer's or brain tumors, but if you have problems with memory that is really affecting your daily life, you need to see your doctor to have this checked out. Then also things like headaches can be tension type headaches, can be migraines. So it's also things that you need to have checked out. Let's go to the eyes. You can see this man is going through difficulty seeing. So things like blurred vision, blind spots, halos around lights, tunnel vision, etc. These can be a sign of probably cataracts, glaucoma, diabetic retinopathy, retinal detachment, or macular degeneration. Now, this may be big terms for you, but we want you to know is you need to see your ophthalmologist and have your eyes regularly checked out, as Dr. Azadeh already explained to you. Let's go down to the chest. You can have chest pain. This can be a central type of chest pain. Sometimes it feels like a heavy weight on your chest. And this can be a sign of a heart attack. Sometimes the pain can also radiate, go down into your arm, your left arm, or to the back or to the jaw. So just be aware so that you can know when to go to EC or when to see your GP so that they can examine you, do an ECG, and see if it's not a heart attack. They will also do blood tests to see your cardiac markers and rule out a cardiac attack. Other things like PE, meaning pulmonary embolus, meaning there's a clot in the lungs, can also cause severe pain. Also, things like infection, like pneumonia. Pneumonia, when you have a pneumonia, you will have an increased temperature, you will be breathing quite fast. So, these are definitely things you need to look out for. Also, be alert that even gastroesophageal reflux disease, meaning you have severe heartburn, can also cause you chest pain. So, there's definitely things you need to look for. Shortness of breath can mean a lung infection, can be pulmonary embolus, can be a heart failure, can be lung cancer, especially if you are a smoker, and even asthma. And you can also see that even asthma can give you wheezing, especially you can get exercise-induced asthma, you can get seasonal asthma, and you need to look out if you hear any wheezing from your chest. This can also be bronchitis, especially from viral infections. That can also give you wheezing, and if it also is accompanied with a temperature, you should look out for these things. Also, chronic obstructive pulmonary disease means that if you are a smoker, it can cause severe inflammation in the airways and actually obstruct the airways, and that causes the wheezing sound that you hear when you have this disorder. Let's look at the abdomen. In the abdomen, you can have pain, especially if you have epigastric pain, if it means in this area. This can be a gastritis. If you have pain in this area, it can mean there's a problem with the liver, or it can be the gallbladder, so cholecystitis, especially if it's accompanied by fever. If it is in this area around here, which we call McBurney's point, it can mean that you have appendicitis, especially if you have rebound tenderness. Now, rebound tenderness means that if you push down on it and let go quickly, you have that shooting type of pain, and this can be appendix that probably needs to be evaluated. Also, IBS, irritable bowel syndrome, if you have pain in this area, or mesenteric adenitis, can also, that's just lymph nodes that are inflamed within the mesentery in this area, can also give you pain. So it's definitely things you need to have checked out. And also, if you have pain in this area, this is the area where the colon is sitting, so you can also have severe constipation and can also give you pain in this area. So just for you to know. Other things like bloatedness. Bloatedness can also come from a bacteria we call H. pylori, Helicobacter pylori. If it's ingested, it can cause you severe bloatedness, but please be aware that your diet also plays a big role in having bloatedness. So please avoid gas type of cool drink, and also a lot of starch products that can also cause you to have bloatedness. Any abnormal bowel movements you should be aware of. So severe diarrhea, that is not normal, and also severe constipation, you should definitely have it checked out, especially if there's any history of cancer in the family. You want to have that checked out if it's not going away. Again, look at your diet as well. You need more fiber in your diet, and you don't want to eat too much solid foods, and drink. You need to drink adequate amount of water, because that will also affect your bowel movements. Let's look at the urological side of it. You can have pain, like this can be epididymitis, testicular torsion. Here I have a picture for you of testicular torsion. You can see this is the normal testis, but it can also happen that the testis can spin on itself and actually cut off the blood supply, and this is called testicular torsion. This is a very painful condition. Then also STDs can also cause you pain. So definitely go, if you have been sexually active, especially when you're not using condoms, you need to have your GP check you out so that you can know if it's not a STD that you're having. Any growths like warts, like HPV, human papilloma virus can cause warts in this, can cause warts, and also varicocele can be painful, and also can form varicocele can form in this area that can also be like a growth in that area, and you need to have that checked out as well. Also, sores can be from trauma. Also, STDs can give you sores, so please have that checked out. Any fluids like a white or yellow discharge can mean an STD, so definitely have that checked out as well. Any urine with blood, especially blood that you can see with a naked eye, it can be a kidney stone, it can be kidney, bladder, or bladder cancer, it can be prostate cancer, or just enlarged prostate. So definitely, if you see any discoloration, especially blood in your urine, you have to have that checked out by your GP so that they can do further tests and see what is going on. Also, erectile dysfunction. This can be a result from diabetes mellitus, heart disease, atherosclerosis, kidney disease, chronic alcoholism, MS, multiple sclerosis, and vascular disease. What happens is it damages the nerves and the smooth muscles and the arteries and tissues that cause an erection. So definitely have that checked out. Also remember that the drugs that you're taking, like high blood pressure medication, can also affect your the erection, and also your testosterone levels can also play a role. As you're growing older, it decreases, and therefore you will can have a problem with erectile dysfunction. When we look at the anal area, any blood, like dark red blood, can mean a stomach ulcer. This is what we call melena stools, is very dark stools, not your normal color. And then bright red blood can just mean that there's an anal tear, so that's more closer, in closer proximity to the anus. So that can mean it's an anal tear, or it can be hemorrhoids, especially if you're straining a lot, if you're constipated a lot, then definitely this can be the case. If you are fatigued, I know it's almost the end of the year. Many people have worked very hard, so they feel the burnout. Stress can also cause you to be fatigued. Like we said, physical exertion, lack of sleep, long COVID. We've seen that people after they've had COVID, and they just have this chronic fatigue. So definitely long COVID can also play a role. But other things that you also need to look at is cancer. So you need to go to your GP to have them to draw bloods, your tumor markers, and have you checked out heart failure, diabetes, liver disease, anemia. So obviously the red blood cells, if they are not big enough, can and which transport the oxygen to the cells to give you more energy. So if they are not big enough, then definitely you can have lack of energy. Depression and thyroid disease are also causes for severe fatigue. So definitely have these checked out as well. Excessive thirst can either be overexertion. I know people are doing desert dash, they're cycling, they're exercising severely. So if you overexert yourself, definitely you will have excessive thirst, but also know that a disease called hyperglycemia from diabetes mellitus can also cause you excessive thirst. This is because the urine in the urine, the sugar is removed through the urine, and what actually happens is it dehydrates your body, and because the water follows the urine, so you'll be peeing quite more, and then also you'll be drinking more to replace that loss of fluid. So hyperglycemia can definitely be a cause of excessive thirst. Also internal bleeding. So definitely let your GP send you for a sonar, do a stool test to see if there's no internal bleeding, so that you can know if you have this problem with excessive thirst. Even things like thyroid problems can also cause you to have excessive thirst. So if you notice any of these signs, please make sure to visit your doctor. Thank you so much. Have a good day. Bye.